more than likely, if there's a lurking, latent, or deep-lying pathogen, more than likely it's going to be in the Qi level, the Shaoyang level. More than likely it's going to be not what you expect, which is what? In school, you learned, oh, the Qi level. That's the bigs. Big fever, big pulse, big thirst, big sweat. That is not the patient you're going to see. You're going to see an echo or a muted version of warm disease because this pathogen has gone interior and it starts to consume yin or fluids. And so what the patient you get will have sort of low-level heat signs or unrelenting fatigue.
I'm Michael Max, and this is Geological, the podcast that curates East Asian medicine and methods through the power of conversation. Not knowing is not a conclusion. It's a starting point. It's the place where things are just beginning to get interesting because the simple math of a situation is clearly not so simple. And that feeling of being a confident smarty pants is now evaporating into the anxious void of uncertainty, which, as an adult, and especially as a professional who is supposed to have answers, well, let's say that many of us have an allergy to uncertainty and not knowing, which is kind of a fun paradox to play with, because if you've spent any time with meditative practices, Zen in particular, just not know is pretty much the center of the practice. Perhaps you can recall a time as well from childhood when not knowing wasn't to be avoided. It's what actively engaged you. What's up around the corner of that creek? I wonder if this vine hanging out of a tree will support me. And just how do you sneak up on a firefly with a mayonnaise jar? There was a time I'm sure you can remember when the invitation to find out was overwhelmingly more powerful than being stopped by uncertainty. Curiosity and the delight of discovery comes natural to children. You'd have to work hard to turn that off, and yet it would seem that in training to be a medical professional, we learn to favor certainty over curiosity. What happens when you bump up against what is this with your patient? Does it send you scurrying for a diagnosis to prop up your sense of competency, or do you engage playfully around the inquiry about what's going on with them? In our training, we learn to seek out and name pathology. It's a useful skill, especially if you want to be a doctor. This is absolutely needed in being able to help people with the troubles they come to us with. We should be good at this. It's a key tool in the kit. At the same time, if all we can do is focus on pathology, if we learn to stand strong on that side of the practice, then it can be disorienting and anxiety-producing when confronted with what we don't yet know. It's troublesome to shift gears from practicing to learning. These are two different modes, and the process of learning always requires an engagement with uncertainty, curiosity, and a kind of inquisitive playfulness. If you're thinking that playfulness means not serious, then watch some children for a while. They're not simply wasting time in amusement. They are pushing the edges of the known through embodied engagement. Not knowing, it does not stop children, or scientists, or the student of anything for which they have a taste. Not knowing, it's the way forward. It's part of what's fun, because there's a treasure to be found as you piece together the map. I don't know doesn't mean I quit. It means here is where to start. Coming up to that edge of not knowing, or to the uncomfortable moment of realizing that what has previously worked now doesn't. These are the moments that demand a re-examination of what we thought was so. It takes a mixture of clarity and courage to reevaluate or maybe completely rethink what were considered to be foundational principles. The doctors who first conceived and contributed to Wen Bing theory were faced with illnesses that didn't respond as expected to previous treatment methods. It forced them to reconsider physiology and pathomechanisms. That perspective It can help us to better understand some of the troublesome, lingering chronic illnesses of our time as well. In this conversation with Kerri Westhauser, we take a look at anatomy through a Wen Bing lens, discuss how pathogens can hide and lurk in different levels, and in doing so, consume qi and cause difficult to pin down symptom patterns. You might be under the impression that Wen Bing methods are for acute epidemic illness. You wouldn't be wrong. But considering Wen Bing perspectives can also help you with a plethora of modern chronic conditions. We're going to dig into it right after a few words from the folks who make it possible for you to enjoy Qiological. Qiological Conversations are brought to you through the generous support of our sponsors and members. You have clinic challenges, our sponsors have solutions. What's better than cupping? Cupping squared. John Stan has more on that in just a moment. Would you like to be able to better help your patients by understanding their blood work? Jessica Parker can take you on that journey. Later in the show, you'll hear how my office runs smoothly with Jane, and Blue Poppy reminds us there's no such thing as a small detail. Your focus and intention are important. Do be sure to visit the sponsors page on the Qiological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast.
Question: why do cupping marks not appear as strongly after repeated cupping sessions over a few weeks? If you've been doing regular cupping on patients, you've probably noticed this phenomenon. The fact that it happens is one of the main reasons to offer cupping to stressed areas of the body regularly, as part of a prevention program. Hi, John Stan here, inventor of the FasciaBuddy Square Cupping System. I invite you to visit fasciabuddy.com/Qiological and watch my short video where I discuss cupping marks with one of my colleagues, and we explore an important question: are they a bruise or a capillary bed flush? Check it out. And while you're there, sign up on the FasciaBuddy website to stay informed of the latest developments in cupping, and as a thank you, you'll receive a free downloadable 5-minute low back, hip, and IT band protocol that you can share with your patients. Until next time, happy square cupping.
What I find really fascinating about Dr. Jessica Parker's work is that she's solving a real problem that we all see in our practices. Patients coming in with labs that say everything is normal, but they're clearly not feeling well. They're exhausted, they're struggling, and they feel unheard. Dr. Parker teaches acupuncturists exactly how to read those labs differently, not as a Western doctor would, but through the lens of Eastern medicine and functional analysis. She shows you which tests to order, how to interpret them, and most importantly, how to finally give your patients the answers they've been searching for. If you've ever wanted to add this powerful diagnostic tool to your practice, her 10-week functional medicine cohort for acupuncturists is exactly what you need. You can learn more at drjessicaparker.com and learn how to see what others are missing. Kerri Westhauser, welcome to Qiological.
Happy to be here.
Actually, I should say welcome back to Qiological. You joined us earlier this year. We had a series in the Shop Talk, a portion of the podcast, talking about Wen Bing. We were doing a whole series on infectious diseases. You joined us for that 25-minute conversation, very focused on Wen Bing. Today, we're here to talk about, guess what? Wen Bing.
My favorite.
How did Wen Bing get to be your favorite?
Well, it's very interesting. After being a clinical supervisor for 10 years at a Chinese medical school, and really, you're seeing you're guiding students and patient after patient, I started really seeing the limits of Zhang Fu pattern differentiation. And that led me to more study on my own. And the more I studied on my own, I went back to what most of us tend to do. We tend to do the classics, right? We tend to go back to Shenghan Lun. And of course, once I went back to Shenghan Lun and the Neijing, I started to, again, people would say, read this book, look, follow this teacher, started to look into Wen Bing. And I began that evolution that hopefully all of us go through in our career, which is from student to I don't know anything to I need to know more things to, and I said this on your last time we met. I said, once you start teaching, you really begin to know what you don't know as you start to have to explain it and suss it out and really dive and teach classes. You start to go, wow, I'm beginning to learn what I don't know because I have to explain all of it. So before I knew it, this deep dive keeps going, and I end up many, many years later as a student of Mazen Al-Khafaji.
Mm.
And he utilizes lots of Wen Bing thinking in dermatology from his teachers. And I think once I got in his classes, which was about, I'm bad with time, about 10 years ago, that's when I think the deepest dive possible came for me, Wen Bing's.
Okay, so Mazen was kind of a catalyst for you in that way.
Absolutely.
Mazen is phenomenally precise in his thinking.
Exactly. And I wanted to become more like that. You always want to emulate teachers. And so as I started taking deeper dives, it wasn't just reading Wen Bing texts, meaning the things that are translated into English. It was also reading a bit more philosophy. I read Marta Hanson's great book, Speaking of Epidemics, which I think that book also had a great influence on me, not so much regarding clinical practice, but understanding the history of Wen Bing over the course of over the course of thousands of years. And really, I think her book opened my mind to the major players, what was going on during these years, how Shanghan Lun methodology was failing many of our esteemed colleagues and scholars of the past, and how it led them through these epidemics to innovate. And once I read her book, that, interestingly enough, really opened the door for me because it was less about clinical practice and it was more about understanding the changing definition of Wen Bing over the years, which to me brings us to now, meaning when COVID happened, many of us had to sort of go, oh my goodness, we're living through a time of an epidemic. And that Wen Bing that we learned in school that we sort of tucked away and thought, oh, that's for acute problems I'll never see because that'll go to a Western doctor or a minute clinic, or I'll never see any of those infectious things. COVID brought it front and center, and here we were utilizing the formulas of Wen Bing in 2020. And I think that sort of trajectory of we get taught this and we sort of leave it on a shelf. It's really, you mentioned this when you opened the podcast, the lurking pathogen theory is really what shines for us in modern day, I'll call it Wen Bing thinking, because the lurking pathogens, which are a huge part of Wen Bing history, really encompass a lot of our autoimmune disorders, chronic difficult disorders, the buzzword of late inflammatory disorders.
Yes, that is the big one, isn't it?
So I think COVID sort of reignited this oh my goodness, let's look at Wen Bing again. And for me, it had been a process of almost a decade of exploring more about lurking pathogen or latent pathogen, or some people call it deep lying pathogen thinking in our modern day understanding of these difficult disorders. And I'm now using more Wen Bing than I ever have with that sort of Mazen piece and then also the COVID piece as they intersected in my career. It really opened me into, again, a deeper dive into utilizing this type of thinking in modern day Chinese medicine.
Yeah, so it's not just interesting history. Hooray for Chinese medicine. We have the Wen Bing theory and, look how innovative we are. COVID brought it front and center, which I think was difficult. I know it was hard for me. I remember looking at at it and going, do I use a Shang Han perspective? Do I use a Wen Bing perspective? You know, a bunch of people said, well, just close your damn clinic because you're not supposed to see people. That was an interesting piece, right? There's all the different social aspects that went with it. The thing that I find really fascinating about what you have to say about this, there's not only the lingering pathogens. We'll just call them lingering because, you know, like you said, there's different ways to talk about it. And, you know, remember years ago, this is a long time ago, Heiner Fruehauf kind of put himself on the map in a way when he published that piece on GU syndrome. And it became a lot of people really picked up on that idea. It rang some kind of a bell. And maybe because it helped explain things like Epstein-Barr or fibromyalgia, these kinds of things, which I think all fit within the rubric of what we're talking about. And then I remember during COVID as well, The Lantern did a really phenomenal series, and it was for free. They just published it and made it available for everybody. And Volker Scheid had some interesting things to say about where things linger and lurk and how they hide, really, from the Wei Qi and all of that. So yeah, I'm very excited to talk with you more about this, and even more so, like you were saying, inflammation is a big thing these days. People come in and use it as a diagnosis. Well, I ask them what's going on. Well, you know, I'm inflamed. I'm like, what the hell are they talking? Like, what does that mean? Yeah, so I was just going to say, the connection with autoimmune, the connection with, air quotes, inflammation, the connection with things that the ordinary person, or maybe not even the ordinary acupuncturist, would think of as, this is, how do I phrase it? This is a manifestation of something that we can take a Wen Bing perspective to and do some good work with.
Absolutely. You know, back to Heiner and GU disorders, you know, this obviously goes back in our history to the earliest, to the Shang dynasty. And this, I think they called it Fuxie, right? And this was like the GU syndrome. So this is a very old concept. And the idea being that something is lurking, more difficult. And the history of the medicine is like, oh, this disorder you will receive, like the Sue Wen, I think it's chapter 3 or chapter 5 talks about, you get a disorder in a certain season and it comes out in another season. And this is again back to like the earliest, they would call it the infancy of like it isn't fully formed Wen Bing thinking, but this early thought on like, okay, something happens and it manifests later. So this obviously goes way back. And this idea of a change of season brings out this warm disease, right? This manifestation later. You know, in modern day thinking, we would utilize this type of idea the same way, except I don't think people are so attached to seasons. Like we are very out of touch with seasons because of air conditioning and our homes are heated. So yes, we know it's summer, we know it's winter, but ultimately, you know, it's really, we're not as in touch with it because like when a disease manifests because of these forced air, forced heat. But back in the day when there wasn't any of this, the signs and symptoms of catching something weren't as obvious in this kind of lurking pathogen disorder, where you would be catching something, but you wouldn't manifest anything. I'm sure you've heard patients say, oh, everyone in my home got sick, but I didn't. You know, when I hear that as a practitioner, I wonder if they did, if something was quote unquote caught, but their zheng qi, their righteous qi was strong enough, they had enough, you know, resources, enough fluids, strong enough blood. So again, they didn't quote unquote catch anything, but could it manifest later in a change of season? Maybe just from stressors, maybe from working too much and overexerting, and there's this weakness that occurs. I would even say in the modern day Wen Bing thinking, even if someone gets an antibiotic for let's say they have a viral condition and they go to a doctor and they just say, take this antibiotic. What's so interesting about that from modern day Wen Bing thinking is that most of these antibiotics are considered bitter and cold. So this idea that the cooler coldness sort of tempered the heat or this warm disease that has come out of the patient, but the bitterness has actually trapped or suppressed or sort of damaged middle burner, like maybe caused a little bit of, heat or damp heat or damage the yang of the spleen. We all know this. If you take antibiotics, you might get a little tummy upset or temporary bowel disorder. And a lot of our functional medicine doctors, integrative doctors, they'll say, oh, take a probiotic after, or because again, there's a recognition that there'll be some damage to the center. And as Chinese medical practitioners, we see that as well, but we also consider the idea of a pathogen being trapped, meaning, again, this heat is resolved, this warm disease manifestation, maybe a fever comes down or you don't feel this as much, but the bitterness now is trapping something. So it's modern day, it might not have been explicitly discussed in these original books. We didn't have antibiotics in these original books. We didn't have vaccines in these original books. But when you look at the thinking, it fits so well to locating a disease in the body. Like Wen Bing thinking, when we talk about lurking pathogens, we'll always say more than likely, if there's a lurking, latent, or deep lying pathogen, more than likely it's going to be in the Qi level, the Shaoyang level. More than likely it's going to be not what you expect, which is what? In school, you learned, oh, the Qi level. Oh, that's the bigs. Big fever, big pulse, big thirst, big sweat. That is not the patient you're going to see. You're going to see an echo or a muted version of warm disease because this pathogen has gone interior and it starts to consume yin or fluids. And so what the patient you get will have sort of low-level heat signs or unrelenting fatigue. This is where we get into these chronic difficult disorders like POTS, where we start to see a person who has changes in heart rhythm or temperature changes or dizziness, or these things start to get very mysterious and difficult. But if you don't utilize Zhang Fu pattern differentiating in your diagnosis and you utilize this, like, where is the pathogen? History. Well, take the history of your patient, right? Find out if they had that classic, they've never been well since this event. When they have these things where they say, oh, you take the history, and they'll say, well, I've never been well since, and they'll give you the history. That starts to build the case for, do they have something deep lying? Do they have something latent? Because, the patient's coming to you well into their disease process typically, right?
Yeah, they're not coming in at the beginning.
Correct.
They've tried a bunch of other things.
Yeah. So the history right there leads you to, okay, I'm going to build a case for, do they, location, where is this? You get the history. Some people, when you take their history, it'll be the reverse. There's no precipitating factor. And you're combing through their history, looking for something that will say, like, okay, this event, this happened. Many of those cases where you don't see the never been well since event, it's often what we call an insult has occurred in the body. Maybe there's a Western medicine they're taking. Maybe there is an overgrowth of candida. I mean, I'm trying to think of random things to tell you that don't sound like Wen Bing, like we learned Wen Bing as a virus or we learned Wen Bing as a bacteria. There are many things that can insult the body and trap things. Like, I have many patients who take steroids, right? They'll have some issue, they go to the doctor, and the doctor goes, hey, take 10 days of a steroid. Steroids, I'm not saying anything good or bad about them, but they, again, can trap things in the body. And so it doesn't mean the patient had a virus or had a bacteria. But again, back to this concept of inflammation, right? Many doctors immediately, that's a common thing to administer. Like, I had a patient who had, out of nowhere, one ear went as loud as you could ever imagine, ear ringing, right? Just like the loudest thing you've ever heard. They go to every doctor, ENT, they go to everybody. Nothing is there, so no precipitating factor, and they're administered a steroid. Now, it's this idea that, the steroid again should quell this quote unquote inflammation that they can't see, by the way, but that's what they're going with as their lead thought. Then the patient eventually ends up in my office. The steroid, in this case, didn't do anything. And I'm left with combing through history, precipitating factors, not precipitating factors. In this case, the patient was on a very high dose of GLP-1, which is very popular right now. And in our medicine, GLP-1s, we often talk about, they cause if I say it quickly, they cause a lot of food stagnation in our medicine, a lot of qi stagnation in our medicine. They cause a lot of heat. They damage the middle burner. They're basically insulting the middle burner. That is the qi level. That is the qi level in Wen Bing. But, because we learned Wen Bing and put it on a shelf for, acute epidemic disorders, we're not thinking about, could this GLP-1 from how we see it as, insulting the body, causing food stagnation, causing qi stagnation, damaging the middle burner, causing heat and possibly damp heat. Could that plus, you build this case of where Wen Bing demands that you build a case for where is this?
If you've listened to this podcast for any length of time, you'll know that I'm a fan of having a small business. Running an acupuncture practice indeed requires attention to detail when it comes to managing your office. And that's why I use Jane to run my clinic. It's not just the excellent EMR or online scheduling system, both of which are a backbone to my practice. Jane also allows me to automate patient communications. They love getting text and email reminders from me, which helps to reduce no-shows. And because I choose the language for these communications, patients think I sent the message myself. They like that personal touch. I'm impressed with how flexible and scalable Jane is. From a small clinic to multiple locations and services, Jane can help you to organize the business side of the house. See how Jane can help you too by visiting jane.app/demo. Sign up for Jane and use the code QIOLOGICAL to get a 1-month grace period on your new Jane account. I like that. So I just want to underscore this for a moment. And I get it, we're often taught, Wen Bing, that equals a viral or bacterial infection. I remember hearing students at other schools say that. And in the particular school I went to, they're like, well, you could kind of talk about it as bacterial, but you would be mistaken. It's not that you would be mistaken. It's just not going to take you down the right road to help you resolve it if you're just thinking about a bug. For exactly the same thing that you're talking about here, Kerri, that something happens, where is it happening? And what kind of mischief is it making because of where it is and the nature of what it is? And I think that's so important. And I very much appreciate your perspective here that the, modern weight loss drugs could have an influence. Look, steroids are used by every Western medicine practitioner because it's a key treatment in their particular toolkit. No harm, no foul. That's what they do. You said something about a patient who might have taken a steroid and they come in and they go, well, it didn't do anything. And it just makes me wonder, because I've heard that too, but it's now making me wonder, okay, it may not have done anything for the problem that you went for, but what has it done to your qi mechanism? What has it done to your digestion? What has it done to the heat or cold in your body? What's it done to your ability to regulate your qi? I think these are really important, and beyond important, just damn annoying questions to answer, because my sense is it's not that easy to puzzle these things out.
No, it's not. And I think we have to, if we're going to think about this idea, I always call it, if we're going to utilize Wen Bing thinking, we have to begin to consider that what we learned as, let's say the Qi level, we learned that as the bigs, right? We have to begin to see that in lurking pathogen, deep lying disorders, or goo, or whatever we're going to call this, that what we will see in our office will not look like that, but it can still be the Qi level, because again, you're looking at what is in the Qi level. The lung is in the Qi level. I know we like to think of lung as, Wei level, but the lung is the only zong in the Qi level. It's like we have to begin to think of the Qi level as deeper than the surface. So it's definitely deeper than the Wei, the Tai Yang level, yet it is shallower than most of our deep organs like kidney or liver. It's that this is why the Qi level, and when we talk about Wen Bing thinking, we say, well, a lot of these pathogens or things that aren't cleared from the body, like we could talk about Epstein-Barr, hepatitis, I mean, all sorts of things. We say if they're not cleared, where are they in the body, right? The Qi level encompasses so much of the body. Again, think below Wei surface, but not at your deepest organ level. Again, if we switch it to Shanghan Lun talk, if we say a lot of these lurking things are in Shaoyang, right? We think of Shaoyang as alternating signs and symptoms, bitter taste in the mouth, and we sort of leave it on that shelf. In the deepest level of Shaoyang is the membrane source. So what that means is, like, if we have a level and we say Shaoyang, there are levels within levels. And if we say the deepest level of Shaoyang, well, what is the deepest level? It's the membrane source. This is again, where, things it's such a common location, but we have to rethink the way we understand these levels. We can't just say Qi level is the bigs. We can't just say Shaoyang is, bitter taste in the mouth, what you learn. You have to begin to recognize the subtleties. What I mean by that is like if we have, let's go back to this idea of lung is in the Qi level.
Yeah, so this is a little bit, I almost want to use the word controversial.
Right.
Just because it's not the way that we learned it. We learn things in school to pass a test. Okay? Clinical practice is another story. And we get some of that in school, but mostly school is to help you pass a test. I really appreciate your thinking here. I'm going to call it Wen Bing anatomy, right? We talked earlier about, Zong Fu isn't really that helpful. We all know something about Shanghan Lun, the 6 layers. What I think you're getting into is another way of thinking about anatomy. So now we're talking about the lung at the Qi level. All right, I got to admit, my brain goes a little boing when I hear you say that. At the same time, I consider the lung as being like the organ of Qi. So tell us more.
Yeah, so let's go back to this first I'll go back to anatomy. Yes, Ye Tian Shi, Wu Ju Tong, all the great thinkers of Wen Bing in our history, they spoke more about areas of the body. They spoke more about networks. They spoke more about cavities and spaces within the body. So this idea of like, where is the pathogen, or where is the disease state, or Wen Bing is so practical in helping us locate pathology. So yes, I will say that it is better to think about anatomy in Wen Bing thinking as like spaces, cavities. This is where we get into Sanjiao theory, right? Upper burner, middle burner, lower burner. These were areas and spaces. So this idea of like thinking differently about lung specifically, we always think of lung as like the tender organ, the most superficial organ, the most yang of yin organ is lung. But the Qi level it starts beneath the Wei and is considered in the body but it's still considered at a relatively shallow level within the body. Meaning, again, think of like, where does instead of just saying Qi level, where does the Qi level start and how deep does it go? So it is actually it's at the border of the Wei level. So it is beneath it and inside the body, but yet still relatively shallow compared to what we say the deeper aspect of the Qi level, which is, again, the deeper layers of the lung. And it's now, if I have to talk anatomy, we would associate it with like subcutaneous tissue.
I really like this perspective. I'm just noodling on it a bit as we're talking and thinking how the Qi level, it touches the Wei. It kind of goes into the Wei. It's a little bit into the Wei. These are not like hard and fast lines. They're more like neighborhoods that blend together. And so we've got like in between the Wei and in between the Moryuan, the membranes, which is a whole other thing. And I want to get into this too because of, all this stuff with fashion. And now there's this whole interstitium idea, which takes the sanjiao as we think of it, but it adds something to it. I really feel like the modern Western way of looking at the interstitium, it doesn't take away from us. It helps us better understand something that we've talked about for a long time.
Yeah, and what's also interesting in this idea of Wei, Qi, I know there's two more, but they're not static domains like there's some hard and fast line. And it's also not one thing. The Qi level isn't one thing. The Qi level has for now, because it's very hard to do without visuals, think of it like upper Qi level, closer to Wei and firmly in the center, and then lower within the Qi level, actually getting closer to the Ying level. And now we're getting closer to the organs. But that area in there is that sort of, again, this idea of subcutaneous or fascia, this idea of this membranes, right? Just like Shanghan Lun, the Shaoyang level has an area higher within the Shaoyang, deeper, and the deepest level of Shaoyang is the membrane source. So these, because obviously we know Wen Bing is firmly based off of Shanghan Lun thinking. So this idea of where is the disease state? And back to your comment about how the lung governs all the Qi in the body, you have to begin to think about when something enters the system and it hides, and when it hides, it transforms. In its hiddenness, it transforms. And as it transforms, it triggers, because it's changing the internal landscape, right? And as it transforms, it can trigger, let's say, a flare, because a patient will come in, they might have a flared state of their chronic disease state, or they might come to us and say, oh, I'm in a really good state right now. And this idea of this expression of something flaring or remitting, this is linked to these terms: low-grade inflammation, autoimmune activation, relapsing remitting. And the way we see it, it's like, as they're quote unquote in a flare, should we help vent and expel it because they are in an expression of manifestation of worn disease? Should we wait? Because basically our understanding is when there's a flare, so to speak, the disease state is what we call active or visible. And when there's a lull or the patient appears stable, we would say deficiencies are more visible. So this idea of this complex patient coming and using this Wen Bing thinking and changing our understanding of what is the Wei level, changing our understanding of what is the Qi level, then it's changing our understanding of, if someone comes to us on 5 medications in a stable state of lupus, you have to know that the pathogens are being suppressed and hidden. Now you have to locate them. Now you have to go through history. Now you have to do all the things to figure out how much damage is occurring. And again, it may be an they may have echoes of the flare in their stability. So again, you'll see patients and they'll be in a flare of their chronic disease. Let's just call it lupus or something. And again, is that a time? That is a time when something is more visible and active. It's coming out as warm disease. We all know the lupus flare, the butterfly rash, all of these symptoms. That is a manifestation coming out of the body. Something's coming out of the system. And again, very often the Western medicines are suppressive, right? Before I end that thought, I want to make a nod to our errors as well. A lot of times these complex patients come to us and we hear fatigue, debilitating brain fog, or whatever the list is, right? And we say, I should tonify them, right? Because we hear this, even though we might have heat signs or other complex things, we also can improperly tonify. It's like a knee jerk to be like, oh, let's tonify them. When in fact, that also can further trap something, even though we think we're going to give them, I don't know, Huang Qi and Dang Gui and whatever to tonify them. We are not seeing the whole clinical picture in Wen Bing thinking to say tonify, because actually, again, it can be very trapping of things. Instead of when do we vent? When do we harmonize? Because very often tonification is last in complex chronic disorders and Wen Bing thinking, right? So I don't want to always sort of poo-poo the Western medical things, but often we can be misled by fatigue really debilitating and think it's time to tonify, you know?
Yes, I would like to underscore that, underscored based on my own clinical experience of I see something and I want to feel like I'm capable and I want to feel like I understand what's going on. And so I will grasp at, I've noticed myself do this. I have to train myself away from it. I'll grasp at something and go, oh, it looks like this. And I know how to treat that. But missing that larger picture that you're talking about, how does that fit in with the larger picture of complex symptomology that I got to tell you, it's hard to stay with it because that complex symptomology makes me feel pretty incompetent because I don't know what it is. And my job is, in many ways, to know what it is, right? That's why people go to the doctor. You're the person who knows, and you're going to fix it. And so I find there's a struggle within myself. Can I keep open to what I don't quite understand? Not throw it away, but not let it stop me either, because at some point you have to come down with a diagnosis and go, this is where I'm going in. So the question that I have is, when you don't know, and often because, especially in the beginning, you can't see the whole picture, Kerri, how do you navigate what you know and what you don't? How do you prevent yourself from coming down on intense certainty, which might have you doing exactly the wrong thing, and able to, work in a loose way, but with some kind of intention?
I think back a little bit when I was talking about history and that never been well since stuff. I think for me, if I hear that from a patient, that is easier for me to treat and diagnose and navigate versus the person who there's no precipitating factor and we're combing through everything. I find that more challenging. So again, back to the person who has something and never been well since kind of idea. And we start to put together where, according to Wen Bing thinking, we hypothesize things are not moving well, functioning well, not communicating well. And again, let's say it's earth, let's say it's spleen and stomach, and you're seeing damp and loose bowel and lack of appetite. Already, the idea is beginning to get areas of the body functioning. So again, back to upper burner, middle burner, lower burner. If the person has constant allergies and lots of sensitivities to perfumes and dust and cats and this, that also is a Qi level issue. I know we always think of lung as Wei level, but now I'm trying to explain here that deep lying evils in the lung are going to, again, hide, and then they're going to start to dry out something or damage yin or blood. Now this patient is reactive and very sensitive. So I'm presenting this to say that when I hear allergies, sensitivities, I am thinking more first about, again, history, tongue pulse. Are there deep lying evils in the lung that are causing this sensitivity? This is the Qi level. And most of us probably have them. Most of us, I'm old, and I had a million antibiotics when I was a kid. My father smoked. So I was around. So we think about these things that, that I think last time we did Shop Talk, I talked about the lung cancers that came from 9/11, the exposures from that event, and how there was no initial manifestation. And much, much later, many people who were at ground zero began having cancers of the lung. And of course, no other factors. The patient doesn't smoke. And of course, we end up finding out that these deep lying evils, right? Plus, of course, traumatic experiences, just overwhelming trauma, and lung being the governor of grief. We talk about how when I see a patient and I hear, let's say, allergies, I'm thinking the Qi level. I'm thinking deep lying, are there deep lying evils in the lung? I'm asking them about, have they taken a lot of antibiotics when they were young? Do they take any Zyrtec or what's the other one? Claritin now. And my patients, they're taking tons of these things. And again, this idea of like, how do we navigate treating? I'm listening. I'm trying to figure out where things are deep lying in the body. I'm seeing the deeper layers and levels of the lung as the Qi level. And I'm seeing a lot of things, signs, symptoms, potentially as echoes or as like where something has hidden and changed the interior of the body. So, long answer to say, I am trying to regulate function. I'm trying to get upper burner dynamics moving better, middle burner dynamics moving better. I'm trying to get organs reconnected. But this idea of, like, again, how do we know where to start with a complex, difficult, chronic disease patient? It's easier when you have a precipitating event. Then from there, you have to see what dynamics you can integrate to get better functioning in the body. Lots of these patients will present as having problems regulating temperature, energy, mood, sleep, digestion, and it's going to be like, where do I even start? Get those systems functioning again, but don't tonify them. Get them regulated, get them harmonized, get them regulated, get them harmonized. As you start to get them regulated and get them harmonized, the person has better appetite, better energy, less sensitivity, better sleep. Yes, you may have to employ heat clearing or moving blood or whatever you determine, but it's this idea of what is now complicating the clinical picture are substantial things like blood stasis or phlegm. This is where it gets very difficult, meaning like you really got to keep your clinical thinking hat on as you say, someone walks in your office and says, I've had, lupus and POTS for 15 years. Now you have to start to wonder about substantial complications, i.e., what has changed in blood, possible stasis, and is there phlegm? More than likely. So eradicating phlegm, trying to improve middle burner function, upper burner function. So sometimes what treatments look like in the beginning don't sound like I'm treating lupus or I'm treating POTS, because that's not how we think, right? We think more about this idea of initially a lot of Zong Fu pattern differentiation. And all I'm saying is if we can expand our thinking well beyond that into cavities and spaces and areas of the body, you will have better outcomes for patients instead of like you now have 7 Zong Fu patterns. They have spleen deficiency, liver stagnation, blood deficiency, yin deficient heat. it's better to think of it in areas and spaces and locations, like, in the chi level, and it's more of an echo. And what are we going to do about that?
Yeah, I love that.
Yeah, and then this idea of relaxing and admitting, right?
Yeah. I'm reminded of when I was in school, I came into a supervisor and talked about like 4 of the 5 Zong having a problem. And his response was, well, what do you have against the kidney? Because that's the only one you didn't include. And I was like, back to the drawing board. And that might even be one of those things that's helpful in clinic. When I notice I've got, 3 or 4 Zongfu overlapping syndromes here, maybe this is a time to pull back and rethink this through some Wen Bing anatomy.
Or just think about a wider lens. Like as you or any practitioner starts to say what you said, like your teacher, like, well, what about the kidney? Why not that? As we start to see 7, 8, 9 Zongfu patterns, widen the lens. Widen the lens because 2/3 of those are in the chi level, the lungs in the chi level, spleen, the liver. I mean, like you're in the chi level. It's just not the chi level you learned in school, like the bigs. It's often going to look more like yin deficiency or blood deficiency and heat, and you're going to be seeing a lot of chi level thinking is discerning between heat and damp and what's more prevalent, or are they equal, or like if I hear more fatigue, lethargy, brain fog, loose stool, I'm thinking, more damp within this versus someone who's like, this heat sensations and rapid pulses and all that. So often within this chi level is not the chi level you learned in school. It's this idea of how these how this level is suffering and what organs are really in here. And again, this idea of below the way, but all the way to that subcutaneous, but not yet at organ level.
That's really helpful. This is really helpful. Talk to me a little bit about regulation versus tonification.
So, what I usually say, and I think you agreed, or you said you concur with this idea of how do we treat complex disorders? And we started with regulating these, like, let's say upper burner, middle burner, lower burner function. It's also this idea about keeping pathways open, in the body in Wen Bing thinking instead of tonifying. So the idea within venting and regulating function is about keeping things open and moving instead of, again, maybe it's closed with damp or maybe there's some stasis. So keep the bowels moving, keep the middle burner functioning. All these ideas of these spaces and cavities in the body in this Wen Bing thinking, if you keep these cavities and spaces, again, mobile, and if you keep these cavities and spaces sort of closed off instead of open and available for something to hide, that can be considered venting, even though it's harmonizing spaces and cavities. So that's a really big point, this idea of keeping things open and moving, but also in these spaces and cavities, keeping them both regulated but closed. So if we say, well, how do you keep a cavity, a space, or an area closed? Shen, what do our all of our classical texts say? Treat the Shen first, right? Treat the Shen first. Shen has to be moving and illuminating and filling all of the spaces and cavities. This is a very unique idea to Chinese medicine. When we talk about like interstitium or these tissues or fascia, we see Shen Ming illuminating the spaces and cavities. This brings us to how many of our patients are having stress, anxiety, depression. The Shen Ming is not mobile, illuminated, and filling these spaces. Thus, the spaces can receive deep lying things hidden. It's a place to hide. So this idea of harmonizing, keeping pathways open, mobilizing the Shen Ming, regulating is so superior to tonifying, because again, in tonification, we need to do it, but it needs to be the last step in this concept. Otherwise, we also trap.
In clinic, there's no such thing as a small detail. The needle you reach for, the formula you prescribe, the moment you choose to listen just a little bit longer. Your patients place their trust in you, and you deserve to place the same trust in the tools that you use. At Blue Poppy, they hold their products to the same standard that you hold your care. Herbal formulas crafted for efficiency, needles that perform the way you expect them to, clinic essentials that arrive on time. Because when your tools are dependable, your focus stays where it belongs, on your patients. No guesswork, no compromises, just steady support behind the scenes. Blue Poppy, the choice of practitioners since 1982. Okay, you just brought in the Shen, which, man, okay, you got my attention with this one. And you've got my attention because I think we have a bit of a fetish in our profession around Shen, that you have to treat the Shen, and that usually means you have to make sure psychoemotive things are all working properly. And we just kind of have this fetish of, well, I'm treating at the level of spirit. Okay, fine, good, fair. But what does that actually mean? Does it mean that someone's trauma is resolved? Does it mean that they did some psychotherapeutic work? I hear you talk about opening the spaces because, like, when the Shen is inhabiting, pathogens can't hide because you're aware of what's going on, right? There's an awareness in there. So is this psychological? Is this spiritual? Is this physiological? Help me better understand this.
Yes, all three. Yes to all three. What I would say at a minimum, and I want to tread lightly on this. I see Shen, as we all do, well, I see it as a yang force within the body that is no longer mobile or is trapped, or again, from life, traumas, accidents, medicines. And so for me, I see it less spiritual than I probably should. That's why I'm treading lightly. I see it as more something I'm trying to mobilize. I'm trying to regulate and mobilize the Shen so it can inhabit more. And so sometimes I have to step in and do a very yang treatment and actively mobilize this. So it's like saying mobilizing yang in a way. It's not saying.
Sounds like it needs a pep talk.
Yeah.
Shen needs a pep talk.
Yeah, and it's not saying tonify yang, it's saying mobilize it because it's.
Okay.
Yeah.
I love it. I love it. Not tonify it, mobilize it. This is back to, in a way, regulate versus tonify. You're making some very, I think, important and subtle distinctions that probably make all the difference in how the treatment goes. Because if we're tonifying, it's easy to trap things. And you can create a lot of stagnation with tonification if things aren't open and moving.
Yeah.
So mobilizing the Shen.
Yes, and think of it also in this idea of when we say keeping all the pathways open and moving things in the spaces and cavities, this Wen Bing thinking. Lifting is I did mention this in the other talk. Lifting is a big part of this. When we say, well, how do you mobilize yang? Obviously, you need acrid herbs. You need lifting herbs, things that can vent. Last time we talked about a handful of different herbs that have this ability to powerfully lift and vent. And again, these are herbs that we have left on a shelf because we were taught they were for resolving an exterior pathogen or for clearing out something in the body like a cold or a flu. But these are the herbs that help mobilize things in the spaces and cavities, lift the yang and mobilize the Shen, because Shen is yang. So it's this idea of like lifting from the Qi level, lifting and mobilizing something. And again, I know we've only really spoken about Wei and Qi. I know there's other levels in Wen Bing, and pathogens are in multiple levels. They're not in one. But mobilizing and lifting rather than tonification, when we have complex disorders with substantial potential blood stasis, phlegm, complicating the deep lying evils, the goo, the lurking, the latent. Because again, like you said, this patient will come to us. We are not the first stop. We are often the third, the fourth, the fifth stop. And what gets very difficult to treat, they walk in the office, like we said, like, what do we do? Vent, mobilize, regulate burners, try to get a better understanding of what is the Wei level, what is in the Qi level. If I have to rethink about this, I'm not going to think about the bigs anymore for the Qi level. What does an echo look like? What does a shadow look like? These, again, are things that are not cleared in the body. They're sort of trapped in the body, and they're damaging your Qi, and they're damaging your yin. And the longer they do that, that's when we get those substantial complications. So regulate, vent, keep things open and moving, mobilize them, lift, but don't immediately think tonify. So much has to get reconnected and recommunicating before we can say, now let's strengthen those connections and communications now that everybody is regulated better, moving better, things are flowing better. Let's now strengthen those. But you can't strengthen something that is trapped or disharmonious or not communicating. Yeah?
Because you'll lock it in.
Yes, and that's where we fail. That's where we fail.
Mm-hmm. Mm-hmm. For those who did not listen to the shop talk, what are some of the go-to herbs that you think about for lifting, invigorating, enlivening the yang, aka Shen? I really appreciate your perspective. Yang, Shen, these are, again, it's a slightly different kind of anatomy. To me, it makes a lot of sense. And again, for me, it's a little bit helpful. Instead of thinking of Shen as this kind of metaphysical thing, it's Yang Qi. It's an expression of Yang. Okay, all right, I can work with that. As a metaphysical construct, I don't have a clue. So what are some of the herbs you like? Or do you also use acupuncture for treating in this way?
Say I use acupuncture as an adjunct to complex disorders, mostly doing herbal, and acupuncture as an adjunct. Obviously, there'll be cases where I will say the reverse, but mostly I'm using herbs primarily. Again, off the top of my head, herbs, and as you know, I'm kind of randomly pulling out herbs, but like lian chow, qinjiao, qinghao, my goodness, qinghao, po xiang, peilan, I'm trying to think of herbs, shigao, I'm trying to think of more herbs. Shirchangpu I like very much.
Oh, I could see that really, and that also very much affects the heart and the Shen, and it's lifting and aromatic. Oh my goodness, I've got a whole new way of thinking about that all of a sudden.
And of course, I would be remiss to not add, because I love Li Dong Yuan, small doses of Chai Hu, Sheng Ma, Jie Gen, Gugen, like a lot of herbs that have aromatic or lifting, herbs that can vent through layers. Many of these herbs, Dandocher, Zhizi, a lot of herbs have venting ability. Juhua, they have this ability, this light, refreshing nature to keep things open and mobile. And of all of them, the Qinghao is one of the absolute best to go deeper in the system, to be able to vent up. It's actually one of the more amazing herbs to not just vent in these upper layers, but actually vent from deeper aspects of the Qi level. Yeah.
Okay. Again, we're back to Qi level as a different, it's not the four bigs, it's this terrain, I'm going to say.
Good word. Good word.
It's a terrain, and I've got a whole new mental construct that I'm playing with here as we're having this conversation. I have several patients that have come to mind that have had some stubborn issues with coughs and respiration, and air quotes here, allergies. And I'm thinking to myself, I think they might have something deeper and at that Qi level.
And again, this is back to that history, right? Precipitating factor, no precipitating factor. What if someone's just been taking 365 days a year of Zyrtec? Well,
Exactly. Or 3 years of it.
or 3 years of it. And that's very drying, right?
What about people who get allergy shots? I live in St. Louis. It's considered an allergy capital. I'm telling you, the people that are in the allergy shot business, they're doing well.
I brought out something, no one can see this, but I brought out something, a piece of paper, because my teacher, this is from my teacher's notes. I was hoping we might have a 1 minute on this. He would say any of these allergy shots, immunizations directly inject pathogens or directly inject their contents into the Qi level, into the Shaoyang level, or deeper. So what if a patient gets, like you said, allergy shot after allergy shot after allergy shot? You have to, as a clinician, wonder about deep lying evils. You have to wonder because,
Yes, well, and they get these allergy shots for years. A course of treatment could be 3 to 5 years.
yes. So you have to begin in this idea of the Wen Bing thinking regarding practical locations rather than anatomy. These areas, these spaces. There must be deep lying evils in the lung. There must be. Now you have to build a case for that, right? We can't just say that and treat it. We have to get more history, tongue and pulse. We have to, a lot more palpation, but you have to wonder about this. That may not be one precipitating factor and they were never well again, but that was a series of pathological insults to the lung itself. That's what was occurring. I know it comes under the guise of, hopefully you'll get these shots and you won't have allergies, but our medicine has to reframe that as continuous insults to the tender organ. That's how we have to see that. It's like a patient says that to you and you write it down like, oh, they have allergy shots. What you should write down is maybe they have deep pathological insults to the tender organ, question mark. And how has that damaged the yin of the lung? How has that damaged, has it been so long that now it's complicated with phlegm or stasis? Is it more substantial now? And now I actually can't vent it out. I actually will have to deal with moving blood and transforming and expelling phlegm. Because again, regarding these spaces, and we say keep the spaces open and vent when you can and regulate function where you can. As you get complicating factors, again, like stasis and phlegm, you can't vent that anymore. Now it's more fixed. And when something becomes more fixed with something substantial, now you have to disperse this. You have to break it up. You have to encourage the body to eliminate it. Can't be eliminated in its state. Now it has to be, again, transformed, broken up, dispelled, because that is now what comes from chronic, let's say, allergy shots, 5 years of them, right?
Now I am thinking and wondering about aspects of my patients who've gotten allergy shots that I have overlooked. There might be things that are now more of accumulations that I wasn't thinking about because, well, allergies and tender organ and lung, and maybe there are other things in there because these pathogens have gotten locked in more deeply. Maybe I've just missed it. It really, Kerri, this conversation raises a lot of uncomfortable questions for me in terms of what I've been looking at, maybe more importantly, what I've been overlooking.
I always say, even as I speak, it just calls us to be better. It calls us to think deeper. It calls us to examine with a broader lens. It like the whole idea of hypersensitivity, even just because we're talking about this whole idea of allergic or intolerance, it opens up a whole new world of improving our treatments. And again, it's just amazing to me as the wider we go in the lens, because our medicine is more macrocosmic, right? Rather than Western tends to be more microcosmic. The wider we go, the more illuminating it is for us. So to me, it's like even speaking about it, it has me rethinking patients of mine as I'm like, gosh, did I miss that? So it's, I hope it's encouraging and inspiring to be like, go wider, look at these things in the networks, in the spaces and cavities, rethink where the lung is, rethink what is the Wei level, rethink what is the Qi level. Think about these herbs that are incredible for venting and opening and keeping pathways moving and mobile and mobilizing Shen, right? Instead of, again, all of us get stuck in patterns. I've been practicing a long time. I am very aware. Sometimes I'm like, I'm stuck in my pattern, even in acupuncture, right? Sometimes I'm like, I'm doing the same points again. Hopefully it's something to inspire us to just be as vigilant as possible in our examination of these things, you know?
Absolutely. And I also want to say that on one hand, it's easy to look at where I've overlooked things or missed things and go at myself with a kind of wagging finger of blame. Okay, it's good to hold yourself accountable. There's that. Fair enough. But there's this other piece that you just mentioned, and I think it's really important. And I think it's part of why practicing Chinese medicine is so dang much fun, which is, well, what is this? And can I shift my lens? Can I open it up? Can I bring in a different perspective? Can I understand the Qi level as being a different anatomy than I thought of it before? And to become more curious and more enlivened about what could this be? How could this be? Be a little friendly with it. It has something to teach us, but man, it's tough learning things in real time in front of your patients.
Absolutely.
But it's also part of the job. So I truly appreciate your perspective on this. It's very helpful. And, so often with these conversations, I feel like I can walk into clinic this afternoon and be not just curious, but curious in a different way.
Yes, with different eyes.
With different eyes. Wow. Well, I think there's probably a lot more to talk about with this. We should probably wind it down for the day because I try to keep these to an hour, and I know that you're on vacation. I want you to go out and enjoy that as well. So appreciate you making time today. But maybe come back and we can talk about some other levels.
Oh, I would love to. I'd love to talk about the Xiaoyang. Oh my goodness, I'd love to talk about that. And the Ying. We haven't even really, I'm going back and forth here, but the Ying level, a lot of great discussions can be had about understanding Ying and Qi and what it looks like when complex disorders are in Ying and they move in Qi, or they're in both, or so. Yeah, that'd be amazing.
My God, we're so geeky. Listen to this. All right, then. If people want to find you and find out more about what you're doing, where would they go?
So right now I teach at Yosan University and the Virginia University of Integrative Medicine as just a teacher in their master and doctor programs, but I do CEUs for Yosan University. So they have an events page. So I try to do one or two a year. I think I have one coming up in October, but anyway, the Yosan University events page. Also, TCM Academy, I put up a series of lectures. Pi Wei Lun, because I love Li Dongyuan, is on there. And I put up my lecture on chronic hives and also my lecture on sort of a foundational understanding of dermatology. So there are some lectures there on TCM Academy as well.
Okay, great. Well, until next time then.
Thank you so much.
Thanks. Well, this wraps up our conversation with Kerri. While I've learned about the 4 stages of Wen Bing illness, I'd not really considered this as a kind of anatomy. That this anatomy, like any anatomy when you think about it, it describes a kind of a landscape that operates both with a normal physiology and function, but also under the influence of lingering pathogens. There are predictable ways that the normal physiological processes can malfunction. Conventional medicine has long recognized that viral infections can result in lingering illnesses like fibromyalgia, Epstein-Barr, and most recently, long COVID. We know that sometimes people don't quite clear a pathogen after a viral infection. You can know when this happens, as Kerri points out. Patients will tell you that after a particular event, they were just never quite the same. Often enough, conventional medicine doesn't have anything to help these folks because these illnesses present a confusing array of odd symptoms that elude the targeted approach of most drugs. Likewise, we in the East Asian medicine world also struggle with the complex and at times contradictory symptoms as well, as we're often looking for a root cause. But in these cases, the root is hard to find. It's easier to home in on a branch manifestation and go to work on that. So we go chasing whatever seems to be present, but it takes us in circles. I find the idea of using Wen Bing anatomy, and especially considering the Qi layer to be more than the big fours, that lurking pathogens can move around within the Qi layer and express as autoimmune conditions and allergies. That seems like a perspective that can help us to not chase symptoms, but instead allow us to better understand the underlying dynamic and, more importantly, to resolve it. Resolve it not with strong, draining medicinals, but with light, aromatic herbs that help to liberate and vent the troublemakers. Mostly, what I take away from this conversation is that innovation requires a capacity to lay aside, not discard what we know, but instead acquire another perspective on the complexities of the human body and to be able to understand both pathomechanisms and proper physiology from another point of view.